cancer, the word which we heard, the first thing comes to mind is anything related to some organ, either lung, stomach, or maybe kidney, or maybe any other organ. But a multiple myeloma, which is another type of cancer, which is a blood related disorder, is a different ball game altogether. To talk more about multiple myeloma, what the patients or the general people should know about multiple myeloma, we have Dr. Soumya Mukherjee to talk more about multiple myeloma for the patient awareness, what the people should take care of, what are the things, the recent updates on multiple myeloma. Dr. Soumya Mukherjee is a renowned hematologist from Ruby Cancer Hospital, Kolkata. Sir, a very warm welcome to you. Is in this knowledge initiative sessions. So, sir, there are different myths and facts which people have in their mind related to different types of cancers, and one among those type is multiple myeloma. So, we would request if you can throw some light on what actual multiple myeloma actually is.
Thank you, Mr. Varun, for giving me this opportunity to tell something about this disease, multiple myeloma, because when we hear the term blood cancer, you know, it is a very dangerous thing. Okay, so multiple myeloma basically is a type of blood cancer. As you can just imagine that the term is multiple and myeloma. There are two words in that. So multiple means more than one, and myeloma is the disease. So it is a type of blood cancer which affects more than one organ size. So it is a proliferation, that is the malignant proliferations of the plasma cells of our body. Right. So what are the plasma cells? They are very important cells. They are type of white blood cells, mature B lymphocytes, which produces the antibody. They're very important. They produces the antibody to kill the foreign antigens. So when there is excessive proliferations of those plasma cells in our body, it can cause problem. It will give rise to a disease known as multiple myeloma, and it affects the multiple sites, especially bones and of our body. So it is a type of blood cancer, multiple myeloma.
Okay, sir. And sir, how common this multiple myeloma is as far as Indian context is and Indian population? How common it is?
Yes. So if you go by the literature, in recent data in India shows it is almost 1.5 to 2 per 1 lakh populations in India. In Western countries, it is little bit more. It is around 4 to 5 per lakh population. But possibly we couldn't diagnose it thoroughly, because in a huge population of like India, it is something, this data is, I think, not 100% true. It may be more, because it is a disease of old age, more than 60. Majority of the patients are more than 60 years of age. So sometimes there are maybe some logistic issues for the proper diagnosis. When they reach the clinic, that is advanced phase, patient usually collapses without any diagnosis. So that's why I think it is more than the data. It should be more.
Because it means like documentation is a little bit less. So
yes, I think so.
Right. And sir, according to your experience, what are the major causes of multiple myeloma?
Exactly, the causes of myeloma, we don't know exactly what causes this multiple myeloma. There may be some, some relation, just like age is very important factors, some race is important, black race, and the patient who is having a monoclonal gammopathy of undetermined significance, it is a very benign spectrum of the myeloma group. They can in future give rise to multiple myeloma. But exactly, there is no definite cause that directly linked with multiple myeloma.
Yes, sir. And sir, would you like to highlight if do the patients feel any symptoms if they are suffering from multiple myeloma?
Yes, that is very important question, Mr. Varun. So myeloma, how a patient presents.
Yes.
The most important presentations are bone pain, anemia. These are the two important. Patient presents with low back pain for a long duration and hemoglobin in the lower range. And everybody thinks, yes, the old age patient, arthritis, osteoarthritis. But when patient comes to us, creatinine level is, 3, 4. So there are few symptoms which we should not neglect. That is the progressive weakness, fatigue due to anemia, patient complaining of low back pain or pain in the rib cage region, or gradually increasing in the kidney, in the creatinine. So these are the few symptoms we should not neglect. You should immediately consult the hematologist.
Right. So how this multiple myeloma is being diagnosed?
Yes. So when the patient presents with this anemia, low back pain, creatinine level is high, calcium level is high, so we have to go for few investigations. Some routine blood investigations like complete blood count, liver function test, and some special investigations like serum protein electrophoresis, immunofixation electrophoresis, and bone marrow, test, bone marrow aspiration, biopsy, and molecular test like FISH and everything. After performing all those routine and special investigations, we can reach a proper diagnosis, and we can uh, stage the disease, and we can clearly say whether the patient is in what risk category is the patient is in, whether it is a low risk or intermediate or high risk disease. So these are the investigations we should perform.
So now the most important question comes to my mind. That means, is the multiple myeloma treatable? And if yes, what are the treatment options there? And how long the
Yes.
survival can be?
Yes. That is very important. Myeloma is a definitely treatable condition, though myeloma is not a curable condition, but don't be disappointed. There are very few diseases in this world which can be completely cured. We couldn't cure diabetes, we couldn't cure hypertension, we couldn't cure, some chronic diseases. So myeloma could not be cured, but yes, there is a treatment. We can control the disease. We can give a patient a very good quality of life. So how we treat multiple myeloma? There are numerous agents, chemotherapeutic agents, immunomodulatory agents, steroids. There are a few backbones of the therapy, these three group of drugs. And apart from that some monoclonal antibodies now available, we can use it. And transplant, the autologous bone marrow transplant is a very important armamentarium in our hand to treat the multiple myeloma. So these are the treatment options. Yes, treatment is a long treatment, at least we have to initially we have to go for 3 to 4 months or 5 months treatment, who is patient, in which patients they are eligible for transplant. Then we perform the transplant, autologous transplant, and those patients who are not eligible for autologous transplant, we have to continue treatment for at least 10 to 12 months. Then we start the maintenance after doing the investigations. So it is a long treatment, and maintenance therapy is needed for lifelong. But patient will have definitely a good life, though it is not a curable disease. And the data, I think your next question, how long the patient survives, isn't it?
Yes, sir.
Yeah, yes. So actually, this is a very tricky question,
Okay.
The survival depends on many things in myeloma. First, initially, what is the stage of the disease? What is the risk categorization of the patient? And how early the patient came to us. So everything depends. So in average, in recent times, the 5-year survival is almost reaching to 60-65% in average. But I have few patients who is surviving more than 8 to 10 years. Okay. So it all depends on early diagnosis. That is the most important. Don't neglect your symptoms. If you have anemia without any cause, if you have low back pain for a long duration, gradually your creatinine level is rising, don't waste any time. Consult your hematologist as soon as possible. Do the investigations, reach a proper diagnosis, start treatment, and I think you'll have a fantastic life ahead.
So means there are chances the quality of life can be improved.
Yes, absolutely.
Yes, sir. During the entire treatment, does the patient need to admit it to the hospital?
Initially, when we start treatment in my clinical practice, I admit the patient for 2 to 3 days, but some patients need more hospital stay because they have some other issues to tackle that issues like renal compromised patient, infection, patient who is having a serious life-threatening infections need more admission. But usually in this treatment is absolutely can be done from the home. Few oral tablets are there, few injections which you can take like insulin. Yes, you can take at home. So there are few medications you can take at home. But yes, definitely for transplant purpose or for some medications, admission is necessary.
Right, sir. Yes, sir. The most important question which can come to in the mind of any of the patient, that means how the patient will come to know that the treatment is working.
Yes. So there are a few guidelines. When we initiate the therapy, after a few months interval, we have to perform the myeloma tests like serum protein electrophoresis, immunofixation electrophoresis, serum free light chain ratio, bone marrow sometimes. So after doing these investigations repeatedly after a few intervals, yes, we can say that we are achieving, we are reaching the treatment. We are achieving a good results for the treatment, and then we can say yes, now you are eligible for transplant, or you can carry on for more cycles of chemotherapy, then go for the maintenance therapy.
Right, sir. And sir, patient with multiple myeloma, can they receive allogenic transplant?
Yes, usually autologous transplant is the mainstay of the treatment, but in few patients like some young patients or some aggressive patients with aggressive disease, we perform allogenic transplantation. But still, uh, allogenic transplant is not the first option. Autologous transplant is the definitely it's having a huge impact in the myeloma therapy, but allogenic it's required for few cases.
Right, sir. So, sir, thank you so much for sharing your insights and your based on your experiences. And definitely, the interaction was very informative. Actually, busting the different myths and giving the new information regarding the multiple myeloma. And we are very much thankful to you, sir, and looking forward for such more informative sessions from your side.
Thank you, Mr. Varun.